Heat illness is a range of conditions caused by the body's inability to regulate its temperature when exposed to excessive heat. It includes heat cramps, heat exhaustion, and heat stroke, with heat stroke being the most severe and potentially life-threatening. Symptoms can include muscle cramps, dizziness, nausea, confusion, and in severe cases, loss of consciousness and seizures. Heat exhaustion.
So, what's the core body temperature range we're looking at?
37 to 40 degrees Celsius. That's 98.6 to 104 degrees Fahrenheit.
Okay, I see. And what are the most common symptoms?
Well, you'll see profuse sweating, weakness, dizziness, headache, and nausea. Pretty standard stuff.
Sounds miserable. How does it differ from heat stroke? That's what I'm really curious about.
Heat stroke is way more severe. Core body temperature is above 40 degrees Celsius, and you'll see central nervous system dysfunction. It's a big difference.
So what's the physiology behind all this? What's actually happening in the body?
The body's cooling mechanisms are just overwhelmed. Blood flow to the skin increases, trying to cool things down, but blood pressure drops. It's a tough situation.
And sweating? Is that a big part of it?
Huge. Profuse sweating, losing up to 2 liters of sweat per hour. This leads to dehydration and electrolyte imbalance. That's a big problem.
So what are the main causes of heat exhaustion?
Prolonged exposure to heat is a big one. Strenuous activity, inadequate hydration, and certain medications can also play a role.
Makes sense. Who's at higher risk, generally speaking?
Children under 4, adults over 65, and people with pre-existing conditions are more vulnerable.
Right. Any specific medications we should be watching out for?
Yeah, diuretics, antihypertensives, anticholinergics, and antidepressants can all increase your risk.
How do these medications impact heat tolerance exactly?
They can cause electrolyte imbalances, reduce sweating, or weirdly enough, sometimes increase sweating excessively. It's complicated.
What about pregnant women? Are they at increased risk?
Absolutely. Pregnancy increases metabolic and cardiovascular demands, making them more vulnerable to heat exhaustion.
And children? What makes them more susceptible?
Children have lower heat tolerance because their thermoregulation systems aren't fully developed yet.
So how can we prevent heat exhaustion? What are some practical tips?
Wear loose clothing, stay hydrated, avoid strenuous activity during the hottest parts of the day, and acclimatize gradually to warmer temperatures.
Good advice. How is heat exhaustion diagnosed? What does a doctor look for?
A physical examination, checking temperature, and assessing symptoms are key. Blood tests and urinalysis might be done as well, depending on the situation.
Okay. What's the first aid treatment if someone is experiencing heat exhaustion?
Move them to a cool place, remove excess clothing, apply cool compresses, and elevate their feet. Get them comfortable.
And fluids. What should we give them to drink?
Offer cool water or electrolyte drinks if they're conscious and not vomiting.
Anything to avoid giving them?
Yeah, avoid fever reducers, salt tablets, alcohol, and caffeine. Those won't help.
What's the emergency medical treatment for heat exhaustion?
They might need supplemental oxygen, intravenous fluids, and electrolytes to help rehydrate and restore balance.
And what resources are available to help people stay informed about heat warnings?
Weather reports, heat safety apps, and local cooling centers are all good resources.
What's the prognosis for heat exhaustion, generally speaking?
Most people recover fully with rest and rehydration. But if it's left untreated, it can progress to heat stroke, which is much more serious.
Right. Heat stroke is life-threatening, isn't it?
Yes, it can lead to organ damage and even death. It's a serious condition.
Wow. Well, thank you for this informative discussion. I really appreciate it.
Heat stroke.
With global temperatures rising, recognition and management of heat stroke is more critical than ever. Joining us is Dr. Emily Zhu, an expert in emergency and critical care. Emily, thanks for being here. Let's begin with the basics. What exactly is heat stroke?
Heat stroke is the most severe form of heat-related illness. It's defined by a core body temperature usually exceeding 40.5 degrees Celsius, central nervous system dysfunction like confusion or coma, and often multi-organ failure. It's a medical emergency.
How is heat stroke classified clinically?
We divide it into 2 main types. Classic heat stroke, which results from passive environmental exposure, like being in a hot room without air conditioning, and exertional heat stroke, which happens during intense physical activity.
Who are the most vulnerable to classic heat stroke?
Primarily the elderly, people with chronic illnesses, or those who are socially or physically unable to escape the heat, such as during urban heat waves. Children, especially prepubertal ones, are also high risk due to their underdeveloped thermoregulatory systems and limited sweat capacity.
What about exertional heat stroke? Who does that usually affect?
Typically, healthy young people, athletes, military personnel, and laborers. It's important to note that it can occur even without extremely high ambient temperatures. Risk factors include overmotivation, inadequate hydration, poor acclimatization, infections, and use of stimulants like amphetamines or MDMA.
Is the mortality rate different between the two types?
Yes, classic heat stroke has a high mortality rate, often over 50%, especially in the elderly. Exertional heat stroke has a lower mortality, less than 5%, largely because the affected population is healthier and treatment is often more rapid.
Let's talk about the pathophysiology. What triggers the systemic breakdown?
It starts when the body moves from a compensable state, where heat loss exceeds gain, into a non-compensable state. This leads to hyperthermia, cellular injury, and an intense systemic inflammatory response. Heat shock proteins and cytokines are released, resembling a septic shock-like syndrome.
And the GI tract plays a role too, right?
Absolutely. Splanchnic hypoperfusion causes intestinal ischemia and increased gut permeability. That allows endotoxins to enter circulation, worsening the inflammatory response and contributing to multi-organ failure.
How is heat stroke diagnosed in practice?
It's largely clinical. We look for the triad: core temperature over 40.5 degrees Celsius, neurologic dysfunction, and recent exposure to heat or exertion. Accompanying signs often include tachycardia, hypotension, and tachypnea.
Are there any red flags we might miss that delay diagnosis?
Yes, heat stroke is often mistaken for dehydration or heat exhaustion. Clinicians may not immediately recognize the inflammatory nature of the illness, which delays aggressive treatment and increases risk of complications.
Speaking of complications, what should providers be watching for?
Watch for DIC, ARDS, liver dysfunction, renal failure, rhabdomyolysis, and severe metabolic imbalances. These can evolve quickly and require ICU-level care.
Are any medications known to increase susceptibility to classic heat stroke?
Yes, drugs that impair thermoregulation like beta blockers, diuretics, anticholinergics, some antidepressants, and psychoactive medications can all raise the risk.
Thank you, Dr. Zhu. This has been a dense but crucial discussion. Final thoughts?
Recognize heat stroke early, treat it aggressively, and don't underestimate its lethality, even in the young and healthy. Preparedness saves lives.
Well said. And thank you to our listeners for joining us on Emergency Insights. Stay cool and stay safe.